Hi, I'm Dr. Nolan at the Oklahoma Shoulder Center, and today we're going to be talking about diagnosis and management of shoulder pain with a focus on shoulder arthritis and shoulder replacement. I'm an orthopedic surgeon. I'm a subspecialist in shoulder and elbow surgery here in Midtown in Oklahoma City. These are some of the hospitals that we operate at across Oklahoma. My background, I went to medical school in the University of Texas Health Science Center in San Antonio. Then I went to residency at Los Angeles County and University in Southern California. And then I did 2 fellowships. A fellowship is an opportunity after residency to go do some specialized training in a subspecialty where you get to focus on just that and do a high volume of just shoulder and elbow surgery for the entire year. So I spent a year at Ballgras Hospital in Zurich, Switzerland, followed by a year in Michigan at William Beaumont. We're going to go through a little bit of the anatomy of the bones at the shoulder joint. The primary shoulder joint is made up of the scapula or shoulder blade bone and the humerus or upper arm bone. That forms what we call the glenohumeral joint, which is your ball and socket traditional shoulder joint. You also see labeled up here the clavicle, which is the collarbone, and it also forms a joint with the scapula shoulder blade bone. This is a picture of the glenohumeral joint. Glenoid is the name of the socket part of the ball and socket joint, and humeral head is the name of the ball part. And so it fits in normally, in normal shoulders, fits into the socket anatomically, and is covered with cartilage so that the 2 surfaces glide smoothly against one another when you move your arm. You may have also heard of the rotator cuff. You may know somebody who's had a tear in it or may have had surgery for it. The rotator cuff is made up of 4 tendons in the shoulder, the supraspinatus, infraspinatus, subscapularis, and teres minor. And together they work to form your rotator cuff, which is important for lifting your arm over your head and rotating in and out. Shoulder pain can come from a lot of different things. There are a lot of true shoulder conditions, and you can also have shoulder pain arising from other places. It's not uncommon that somebody has, for instance, a pinched nerve in their neck that can be causing shoulder pain. When you have a shoulder disorder, it can cause not only pain, but it can interrupt your activities and cause problems with sleeping very commonly. In order to diagnose shoulder pain, we have to take a thorough medical history, understanding the nature of the problem that you're having, as well as any other medical conditions that you might have. We ask questions like, how and when did the pain start? And if you've had it before, or anything like it before, what things aggravate the pain, what things make it better, what kind of treatment you've had so far. We typically do imaging. What type of imaging you need depends upon what type of diagnosis we're suspecting. The different types of imaging some are better for evaluating different types of things than others. And sometimes we order additional tests such as labs. An X-ray evaluation of the shoulder is typically a starting point for most shoulder conditions, and typically would be done if we're suspecting arthritis. These are 3 different X-rays of the shoulder. On the left, you see a normal shoulder with a normal glenohumeral or ball and socket joint. In the middle, you see an arthritic shoulder, and we'll go through these more in the subsequent slides. On the right is what we call rotator cuff arthropathy, which is where there's a big tear in the rotator cuff that has led to destruction of the joint. In a normal, healthy shoulder, there's a normal joint space that's filled with fluid for lubrication. And as I said, both of these surfaces are covered in cartilage, and that allows the joint to move smoothly. The humeral head is normally a ball-type shape. We have a normal subacromial space. That's the space between the ball and the flat bone on top, called your acromion. And a normal Gothic arch, or sometimes we call this Shenton's line of the shoulder, which is this arc drawn in green here. In an arthritic shoulder, the joint space goes away. We lose the cartilage lining of the socket, and we lose the space and lubrication. And the humeral head shape becomes abnormal. Osteophyte is a fancy word for bone spurs. So what you're seeing sticking out down there is a big bone spur. In this case, this is a patient with osteoarthritis, and they have a normal subacromial space and likely have a good rotator cuff. But you'll see in the subsequent photos where sometimes that can become narrowed. And in this case, there's a normal Gothic arch. By comparison, patients with rotator cuff arthropathy can have the loss of the glenohumeral joint space as well, but the humeral head starts to move out of, the ball moves out of the socket, and we call that escaping. When it escapes, it rides high and is contacting that flat bone in the top of the shoulder called your acromion. You can see where the humeral head shape is abnormal here as well, but in this case, as opposed to the other one, we've lost that space between the ball and the flat bone on top, or the subacromial space. And because the ball is no longer centered in the socket, we also don't have a normal Gothic arch. In order to treat shoulder pain, we start with the least invasive options first. That might be something like rest or physical therapy. We use anti-inflammatory medications like ibuprofen very commonly, as well as we may sometimes do injections. If you are not getting relief with the conservative treatments, that's when we start considering surgery. And for folks with end-stage arthritis of their shoulder, the typical surgery would be a type of shoulder replacement. Another word for a shoulder replacement is arthroplasty. This is a picture of different types of shoulder replacements, and we'll go through them individually in a moment. On the left, you see a hemi-arthroplasty or partial shoulder replacement, hemi like hemisphere, so half a shoulder replacement. In that case, you're just replacing the ball part of the ball and socket joint. In the middle part is an anatomic shoulder replacement, total shoulder. And it's anatomic because it's your anatomy like the way that you were born. So you put a ball where the ball was and a socket where the socket was. On the right is a reverse shoulder replacement, which is in the reverse orientation, putting a ball where the socket was and a socket where the ball was. In a hemiarthroplasty or partial shoulder replacement, we put a metal ball where the humeral head or ball part of the ball and socket joint was, and we don't put any implant on the socket side. In an anatomic total shoulder replacement, again, it's the anatomy just like you were born, except replaced. So we put a metal ball where your ball was, and we put a plastic socket where your socket was. That's fixed to the bone with bone cement. In a reverse shoulder replacement, you have a ball where the socket was, and that is fixed to the bone with screws and base plate, which you will see in a later photo, and then the socket where the ball was. There is a poly or plastic piece in between the two so that the metal is not rubbing on the metal. This is some of the technology specific to the Stryker shoulder replacements. Some of the things that it allows us to do. One is the platform stems, which makes it convertible. So if you had one of these types of shoulder replacements and at some point it needed to be changed to one of the other types of shoulder replacements, you could do that without having to change the stem part. The polyethylene, which is a fancy word for plastic, and it is an important part of the system because how the polyethylene is made and how it is sterilized are important for how strong it is and how long it lasts. We have these smart lock screws so that we're able to put the screws in different angles, and that allows us to get the strongest fixation into the best bone. And titanium is this coating on the back of the base plate you can see there in the reverse shoulder, and that's what the bone grows onto. After the shoulder surgery, expect normally a reduction in joint pain. Most people have great pain relief with this, and also most people have an improvement in their ability to do what we call their ADLs, their activities of daily living. You should discuss with your surgeon what your goals are, as well as the recovery process and the postoperative rehab. In general, it's tailored to each patient, and different surgeons have different preferences. Thank you for joining me today, and if you have any questions, feel free to reach out.